According to the Mayo Clinic, Ortho-Evra is a contraceptive method that's a patch designed for women to put on their skin that contains the hormones estrogen and progestin. To use Ortho-Evra, you apply the small patch to your skin once a week for 3 weeks, and you skip the 4th week to give way for menstruation to occur. And Ortho-Evra works similarly to birth control pills because it prevents pregnancy by releasing hormones into the bloodstream that suppress ovulation. It also thickens the cervical mucus to keep sperm from reaching the egg. Picture demonstrates there are 4 places where it's recommended for the patch to go on a female's body. For example, we have the patch going on the abdomen right here, as well as on the opposite side of the abdomen, and the patch can also go on either shoulder or on either upper arm. And the key of this is so the patch isn't affected by tight clothing. Look, different examples of how the patch looks like on different areas of the woman's body. It's important to note here that the patch is the only contraception method that's approved by the FDA in the United States. The failure rate for this contraception method goes for perfect use, it's at 0.3%, but for typical use, it's at 9%, which means that for every 1,000 women that use this, even if they use it in typical use, 9 women will end up pregnant. The patch is used to prevent pregnancy, and it has a couple of advantages over other types of birth control. For example, it eliminates the need to interrupt sex for contraception, and it doesn't require daily attention. It provides a steady dose of hormones every day, and it can be removed at any time. So if the woman using this method of contraception decides that she wants to be fertile again, she can choose to do so by simply removing it. The downside to Ortho-Evra is that this method of contraception does not offer any protection from any sexually transmitted infections. And some side effects of Ortho-Evra may include breakthrough bleeding or spotting, skin irritation, breast tenderness or pain, menstrual pain, headaches, nausea or vomiting, abdominal pain, mood swings, weight gain, dizziness, acne, diarrhea, muscle spasms, some vaginal infections and discharge, fatigue, and fluid retention. If you want to buy the patch, it's important to know that this method of contraception is actually around the same price point as today's leading birth control pills, but it's only available by prescription, and your doctor might recommend against getting this method of contraception if you're age 35 or older and smoke, if you have chest pain or a history of heart attack, stroke, or severe blood pressure, if you have a history of blood clots, if you have a history of breast, liver cancer, uterine cancer, if you weigh more than 198 pounds, if you have liver disease, migraines with aura, or diabetes-related complications of the kidneys, eyes, nerves, or blood vessels, if you have unexplained vaginal bleeding, if you develop yellowing of the whites of the eyes or the skin, in other words jaundice, during pregnancy or previous use of hormonal contraceptives. Also, if you're about to be immobilized for a prolonged period due to a major surgery, it's a bad idea. And also, if you are sensitive to any components of Ortho-Evra. And in addition, if you want to use this method of contraception, it's important to tell your healthcare provider if you're breastfeeding or recently gave birth, or if you had a miscarriage or an abortion, if you have breast lumps, fibrocystic disease, an abnormal mammogram or family history of breast cancer, if you have epilepsy, diabetes, or gallbladder, liver, heart, or kidney disease, if you have high cholesterol or triglycerides, if you have irregular periods, have depression, or have any skin conditions such as psoriasis or if you use this method of contraception, then the best way to start using it is by applying the patch on the first 24 hours of your menstrual period. And the way you apply this patch is that you take it out of its packaging and it has a clear plastic on the half where the patch is actually going to stick on your skin. Make sure the skin is completely clean, bacteria free, no dirt at all. Then you're going to want to take off half of the clear plastic and then apply that part on your skin. And then once that's there, you take off the rest of the clear plastic and then you lay the other half of the patch on your skin. And then you press and hold for at least 10 seconds to make sure that the whole patch adheres completely to your skin. And run your fingers over the entire surface area to smooth out any wrinkles at all to make sure that the outer edges of the patch are also completely adhered.